this picture is showing this really wide lower traps, which is really not the case. So we're going to be methodical. And so all of our muscle palpations, I want you to try to be methodical. So the first thing I'm going to do is come right here where Adriana is, and I'm just going to look, because and those of you who can come over here to look, you should do that. I can just see, it's like almost like kind of like a hood of tissue right here. So those of you who are there can see that, right? There, and you see that right there? So that's part of his upper traps. The upper traps is super thin, and underneath that is the supraspinatus muscle. So when you're palpating this, I want you to show me that you know the difference. So if I came up to Joel and I was palpating his upper traps and I did that, what have I got in my fingers there? Any guesses? Upper traps and supraspinatus. But if I just drew upper traps or trapezius, I need to be able to show that I know the difference. Okay, so that's part of that. How can I tell that you know it's right? Okay, so you're going to come up here and this is where I like to start, just right there. And then you're going to follow it up, and I'm going to palpate across because the fibers go like that. So I'm going to palpate perpendicular. I just barely feel the edge. And it's going to just come all the way up to that ridge at his occiput. Okay? All right, now I'm going to come back down. Palpate that down to the clavicle. Now, I think your book mentions it, that the attachment sites for the deltoid and the trapezius here are pretty much the same, right? So your deltoid comes around like this, and your trapezius also comes around like this, just on this side. All right, so I'm going to palpate that as far as I can out to the clavicle. So the middle traps, as you'll recall, are going to go from the spine. The spinous process is out to the spine of the scapula. So I'm in an awkward position. I'm just going to do it like this so you guys can see it better. So I'm going to locate the spine of his scapula. So it's right there. Okay. And so here's my upper trap that I just palpated. And there's the middle trap right there. Okay. It's not all in here. It's just right there out to the spine. Then our lower traps is going to come from the base of the spine straight down to about T12, okay? And there's sort of this convergence of tissue at the base of the spine where a lot of fibers come together. And so on some of, probably not many of the females, but on some of the males, it's going to be like a lump of tissue like I showed you on Matt's, the student that I had that picture of. So the way we're going to find this border, which is this very, very thin, probably if I had to just guess where it was, I would say it's like that, right there. I want to find that border if I can. And so in order to give myself the best shot at finding that border, I'm going to find the two ends exactly where it should go from here to here. So I'm going to go back here and relocate the spine of the scapula. And he does indeed have a big convergence of tissue right there. So I'm going to go to T12. So how can I easily find T12? Well, we have 12 ribs, right? We have that last floating rib, which we know attaches to T12. So I've got my superior landmark here. Joel, I'm just going to warn you, I'm going to reach into your side. Is that okay? You're not a giggler, are you? Okay. Sometimes we have gigglers. So I'm going to come in here again with my whole hand. I'm not going to do this, right? I'm come in with my whole hand and locate where I can feel that floating rib. So right about where that floating rib is, if I just come right like that, I'm probably on T12. I'm close enough, okay? So here's my two landmarks, here to here. So I know that that border of that trap, lower trap, is going to be right like that. So I'm just going to come on here. See if I can feel it, just barely. Just going to palpate that all the way up until I get this big convergence of muscle at the base of his scapular spine again. Another thing we can do, Joel, are you able to put your arms over your head? just kind of like fly like Superman. Can you do that? Just raise your, yeah. Can you raise these arms up at all? Okay, that's good. All right, well, we're getting a lot of erector spine. I know he's uncomfortable there, but you can just kind of see, good, relax. That lower trap, do you see that right there? The ones that are running straight like that were really popping up are not part of the traps. That's the erectors, and they run straight up and down, whereas this one runs at an angle. Go ahead and relax your shoulders so you're comfortable. Good. And can you just lift your head just a little bit? So you can have your partner do that. Sometimes it makes it pop up a little bit easier to palpate. Good, relax. But the two kind of speed bumps that you see under there are really semispinalis capitis with the traps sort of lying on top of it. You don't need to know the semispinalis, but just know that the big bumps do have trap, but they're not all trap. Okay? All right, so I'm just gonna review one more time. You can start at the occiput if you want to. I like to start here because I think it's the most obvious place to start. It's easy to find on everybody, and I'm gonna feel just the upper trap as it comes out to the clavicle. And I'm gonna come back. Feel it as it comes all the way up to the occiput. So that's my upper trap. Next I'm going to locate my middle trap, and I'm going to do that by locating the spine of the scapula. So there's the spine of the scapula. So I know my middle traps run like this. The direction of the fibers are the same as the direction of my fingers. So how am I going to palpate here? Am I going to palpate here? Am I going to palpate across? Right. So I would actually come up to the head of the table and palpate like this. Okay, so you're going to palpate across. Just try to appreciate those fibers. And as you are learning these palpation skills, I want you to really kind of like tune in and say, can I really feel those fibers? Like, can I feel the direction of those fibers? That skill can take a while, but some are going to be easier than others to feel. All right, so middle traps, and it comes to the spine. Next thing I'm going to do, locate the base of the spine. Nice trigger points there that somebody can work on for you when we do massage. I'm going to come into his side, locate that last rib, come up there. I know that the lower traps are going to be between my two fingers, so I'm going to try to palpate that border, which I can actually feel a little bit better this time than I did the first time I went through it, all the way up to the base of the spine. Okay? So I palpated all of the borders and the bellies as well. This one's so thin you're really doing the belly and the border at the same time. Okay? Questions? Okay. Thank you, and I'll work